Yes. So now let us see this one very clearly. So you hear a hospital nurse talking to a patient. So hospital nurse is talking to a patient. That means two people are talking. Let us say roughly 50% of the speech is for nurse, 50% of the speech is for patient. So patient is talking. Now here the question is asking, the patient expresses a concern about. So who is expressing? The patient is expressing. And the nurse is listening. The nurse is listening. Now what is the most important point here is concern. Now whose concern? Patient's concern. So patient concern will come from the words of patient, not from the nurse. Nurse can give suggestions. Nurse can give some procedure details. Nurse can explain something. But what concerns the patient has, the words will come only from the patient. So you have to listen to the patient more. That means you should give more importance, 75% importance, 80% importance, or 90% importance to the patient's words, because the words come from his mouth. Remember that. So having to make use of a mobility aid, make use of a mobility aid. So aid means a support, mobility aid. So the most important word here is mobility aid. So she needs having to make use of a mobility aid. So it is regarding mobility. The problem is regarding mobility. So she needs an aid. She has problem with mobility. She has problem with mobility. And here also mobilities. Try to understand the same word. Mobility, mobilize. And here also mobilize. So mobilize is common here. Mobilize is common. That means this is not very, very important word. So you are not supposed to think about this word particularly. So mobility is the problem. That's sure. Mobility is the main problem. Okay. So this is eliminated. We are not bothered about just mobility, but something else. So now what is the problem? Having to make use of a mobility aid. Making use means how to use. Okay. Being expected to mobilize without assistance. So without support is the problem. So support is problem. She needs a support, and you cannot expect her without support. So don't expect me that I will mobilize without, I need assistance. So don't expect me that I can mobilize without assistance. I need assistance. So that is what she is saying. B, she says, I cannot mobilize without assistance. So don't expect me to mobilize without assistance. I need assistance. So assistance is required. That is her problem. Without assistance, she cannot. So that is her concern. Okay. Next. First one, having to make use of a mobility aid. So for mobility, she needs some aid. For mobility, she needs some aid. So make use. So using the aid. Using the aid, make use means using the aid. Using the support. So having to make use of the mobility aid. That means, why should I use aid? Why should I use support? So using the aid is the problem here. Maybe she doesn't want to use the aid, or she cannot use the aid. Assistant supports like wheelie walker or chair or frame or whatever it is. So that is her problem. Using aid is the problem. Here without assistance is the problem. Using the aid is the problem. Without assistance is the problem. So here the problem is aid, and here the problem is assistance. Okay, fine. Next one. Feeling unsteady when he is attempting to mobilize. So when he is, try to understand, he, that means the patient is a male person and the nurse and the nurse is a female person. So you have to hear for the male voice, not female voice. You have to focus on the male voice here because he is attempting to move. He is male. Now only we come to know that the patient is he. He means male. He means male. So you have to see, this is how you have to understand. If you don't bother all these things, it will be very, very difficult for you to gain control. It will dominate. The speech will dominate. No, you have to dominate the speech. If you want to dominate the speech, you should understand these deadly secrets. This is called code of secrets. You now know. See, till now I did not know that it's a male person. But now I know that male person. The patient is male. So if the patient is male, the nurse is female. Always it will be cross genders. If the patient is male, the nurse will be female. If the patient is female, the doctor will be male. That's all. There's no other option. To avoid confusion, they'll give like that. So be careful. So feeling unsteady when attempting to mobilize. Feeling unsteady. So using aid is the problem in the first one. Without assistance is the problem. Feeling unsteady is the problem. So now, what is the point here? Steadiness is the problem. Steadiness. First one is aid is the problem because she wants to use the aid and she is concerned about using the aid. Maybe I cannot, maybe something problem, and maybe if I cannot use, maybe. So she has some concern regarding the using the aid. She has a problem with mobility, that is for sure. She has a problem with mobility, that's for sure. Okay. Now here, using aid means instrument. So here, instrument is the problem. I'm bringing out new vocabulary here. Instrument or the equipment or the aid, medical equipment or the aid like wheelie walker or wheelchair or walking frame or walking stick, whatever. That is the problem here. Equipment is the problem here. And here, without assistance. Without assistance. That means that she needs somebody, not person. She, without assistance, with the assistance maybe of equipment or person or relative, anything. So assistance is the problem. Support is the problem here. Support is the problem. Okay. Then here, steadiness. Her own health is the problem here. Physical health. Physical health is the problem here. In C, health is the problem. Yeah. And here, support is the problem. So without support, without assistance, she cannot do. I have given 3 new words here. Right. And here it is health. Health is not permitting, unsteady. Body is not steady. Body is not strong. So feeling unsteady. So it is her own problem in C. Equipment, doubt on the equipment, whether she can manage or not. That is A. And assistance, either equipment or person. Maybe some other person, support. Any support. It may be instrumental or it may be personal support. So this you have to understand. So focus mainly on these 3 words. What are the main words here now? First word is aid. Aid means support. Equipment, wheelchair, anything he may speak. He may talk about anything. Now you are mentally ready. Okay. Then here assistance. Assistance of a caregiver or a family member or social worker or somebody or wheelchair, anything like that. Okay. Expectation. Here using is the problem. Here expectation is the problem. So feeling unsteady. So steadiness is the problem. So focus on these 3 aspects only. Focus on these 3 aspects only. Don't go. You'll definitely get this mark if you can focus on these 3 points. Concern, problem, worry, issue. Already mobility is the problem. But She knows that she has a problem. But what is the concern about mobility? Is it regarding aid, how to use it? Or is it regarding assistance? Don't expect me to use, to mobilize without assistance. Don't expect me, I cannot. So that is her concern. Okay. I need assistance. There's a problem. I need assistance. She is sure. That is B. Then next one, C. I cannot stand properly. How can I walk? I cannot stand itself. I'm unsteady. My bones, my body is not stiff. They're weak. They're vulnerable. They're helpless. They cannot contain me. They cannot make me, permit me to stand for some time. Then how can I walk? That's very difficult. Okay. So that's what you have to focus on. Now I'm going to play the audio.
Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of 51 to 42. Choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear Dr. Pietro Everall giving a presentation on the subject of collective
dysphagia and dribbling of saliva, for which a speech pathologist offers.
I use my frame when I'm walking. I was told to keep my personal belongings within reach and report any spills immediately. Little nurse talking to a patient. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a hospital nurse talking to a patient. Now read the question.
Hi there, I'm Dory.
1 minute. Can you hear that one? Sorry.
Rehabilitation Center. How are you feeling today?
Oh.
Okay, just a bit tired after the surgery.
That's all.
Complete your answers as you listen. Now look at question 25. You hear a hospital nurse talking to a patient. Now read the question.
Hi there, I'm Dory. I'll be your nurse while you're here at the Rehabilitation Center. How are you feeling today?
Okay, just a bit tired after the surgery.
That's understandable. I need to go over the falls policy with you. As you know, falls can be a significant risk for patients, especially after hip replacement surgery like yours. It's important to take precautions to minimise the risk of injury. Are you familiar with the policy?
Well, I know to use the call bell if I need help getting out of bed and to use my frame when I'm walking. I was told to keep my personal belongings within reach and report any spills immediately. What worries me is that I keep coming over dizzy when I go to stand up. I guess I should just keep still and wait till it passes?
You certainly shouldn't try to move. And press your call button if you can, and we'll be straight with you.
Question 26.
Yes, now you can
You
write
hear
your
two
answer.
community nurses conduct.
You can write your answer. Yeah. You can write your answer, please. Okay. Now, who gave the answer? Let me check. Sandeep gave C. Then Jasdeep Kaur. Only Sandeep gave. Jasdeep Kaur also gave. Okay, C. Okay. Yeah. So Sandeep Kaur. Yes, very good. Can you please explain me why you think C is the answer? Sandeep Kaur is my regular student. She is from Punjab and she is from the USA. Okay, Sandeep Kaur. Yeah. If you're comfortable, you can explain. Okay. Otherwise, Jasdeep Kaur.
Yes, sir.
Yeah. Jasdeep, can you explain why you think C is the right answer?
Because he said he feels undizzy when he stand up. So patient said the more worried about.
Hmm.
So
More he's
the
worried about what?
feeling dizzy when he goes to stand up.
So, okay, when he attempts to stand up or when he goes to stand up, he feels dizzy. That's what you heard, right?
Yes, sir.
Okay.
My
Now,
main focus
yeah.
was when he start now what more worried about.
Hmm.
So that's why.
Okay.
And you said that it's a health issues, so more focus on that thing.
Okay. Now let us check this one. Let us check the answer. Yeah. So 25 to 30. Yes, here it is. Hi there, I'm Dory. I'll be your nurse, Dory. This is a female nurse. Right. Now let us see what they are speaking here. How are you feeling today? Okay. Male voice. Okay. Just a bit tired after the surgery. That's understandable. Okay. Now we have 3 points. We have 3 points. Now let us see. We have to focus on male's voice only. No need of focusing on female's voice. Okay. So just a bit tired, male, this one. Number 1. So focus on this one. Just a bit tired after the surgery, nothing else. So no, answer is not there. So maybe here. Definitely answer will be here. Now let us see. Well, I know to use the call bell if I need help getting out of bed. Okay, so no problem. That's not a problem. And to use my frame when I'm walking. So frame, walking aid. I know. I know. Try to understand when he says I know, that means that is not a problem. I know to use. I know to use. I know because I know how to use. What to use? The call bell if I need help. If I need assistance, I know. how to use the call bell if I need help getting out of the bed. So if he needs to get out of the bed, he knows, okay, how to use the calling bell. That's it. So that is number one. So he can take the support of somebody, right? So no problem with that. And he also knows to use my frame. I know how to use my frame when I am walking. That's also not a problem. So two problems are ruled out. Two problems are ruled out. But the problem, concerns. So here, no concern. I know well. I know to use the call bell. So I know to use the call bell. So let us see here. Here, no problem at all. He's not saying that he has any problem. I know how to use the call bell. If I need some assistance, if I want to call somebody to get out of bed, I can call somebody for assistance by using the call bell. So I have no problem, okay, to get support. I don't have any problem. And I also know how to use my walking frame. This is aid when I am walking. So this is also no problem. I know how to use the call bell. I know how to use my frame. Frame is the aid. Call bell is for support, assistance. From a nurse, or if I call bell, if I ring the call bell, somebody will come and help me. So I know I have no problem to get assistance from anybody, because I can ring the call bell and I can call somebody to help me to get me out of the bed. I have no problem with A. I have no problem with B. A is aid. B is assistance, calling somebody for help. So A is using my frame, that is aid. B is calling somebody for support, that is using the bell to call somebody. So I don't have any problem with these things. I was told to keep my personal belongings within reach and report any spills immediately. So that is also no problem. There's just information. What worries me, this is the concern. Concern in the question. What concern does the patient say? What concern? What is the patient? Patients express his concern regarding what? Regarding what? What means that? What means that? What is that? That is a book. I want a book. What? I want that. That means what? That's a book. A book. A notebook. Or a textbook. So that means what? What means that? What did the patient concern regarding? So, what worries me, what confuses me, what I face a difficulty is that, what my worry is that, my problem is that, okay, I keep coming over dizzy. I keep coming over dizzy. Dizziness. Dizziness. That means helpless. Physically weak, dizziness, or giddiness. When I go to stand up, I guess I should just keep still and wait till it passes. After, when I want to get up, I feel dizzy. So until the dizziness passes away, I have to keep standing like that. So that is the problem. Okay, that is the problem. So dizziness is problem. Dizziness means what? When he is trying to stand up, he is feeling dizzy. Dizzy means, you can say giddiness. When you are giddy or when you are dizzy, you will be not steady. You cannot be perfect. Okay, it can be said unsteady. So that is what it is. You feel unsteady. You feel unsteady. Feeling unsteady when he is attempting to mobilize. That means to stand up, to go somewhere, to move, or to take something, he has to stand up. In order to stand up, when he is trying to stand up, he is attempting to mobilize, he is feeling unsteady. Right. What worries me is that worry means concern. The word worry means concern. Where is the word worry? I told you the same word will not be there. I gave 4 or 5 words, but those words are not there. The word is there, worry. Now, if you see, if you check this one very clearly, the patient expresses a concern about. The patient expresses a concern about. Concern means I said problem, I said difficulty, I said issue. Problem, difficulty, issue, concern. These are the 4 words I said. But there is a totally new word here. What worries me? What concerns me? What topples me? What upsets me? What irritates me? Okay. So there are other words also. So be ready to catch those words. So what worries me is that I keep coming over when I go to stand up, when I attempt to stand up, when I try to mobilize, I feel dizzy. That means feeling unsteady, dizziness. You know what is dizziness? That is unsteadiness, lack of steadiness. That is unsteady nature. So that's very clear for you, I suppose. Any doubts? Any doubts? Yeah. Is that clear? Jasdeep Kaur. No, sir, you are not clear. Okay, I will unmute you. Yeah, tell me.
Sir,
Yes.
it's clear. I said no doubt.
No doubts, huh? Okay. Is there any doubt? You said no, so I thought, okay, fine. Right. Very clear. That's good. Awesome. So this is how you have to analyze. First, what you have to do is, you hear a hospital nurse talking to a patient. So who is talking to whom? So hospital nurse is talking to a patient. So 50% nurse, 50% patient, or 60% nurse, 40% patient, or 40% nurse, 60, whatever it is, we are not bothered. But here, nurse is male or female, patient is male or female. How do we know? We know that by the word he. He is the patient. So male patient, so female nurse. That's very clear. There will be some clue like this. So you are going to the patient express. Patient means male. Expresses a concern. So the patient has a concern. So you should listen to the male voice more than the female voice, and you should think about the word concern. What is the synonym for the word concern? I have given you problem, issue, challenge, challenge I did not say. Problem, issue, difficulty. 3 words I gave, concern. My main challenge is, my main worry is, I am confused about, I am worried about, something is irritating me, that is about. So any word may come. So you should try to catch that particular word. Here that particular word is worries. Only after the word worries, then the word will come. That I keep coming over dizzy. Dizziness when I go to stand up. So dizziness. Dizziness means what? You cannot, when you are dizzy, you faint. When you are dizzy, you will be helpless. When you are dizzy, you are not steady. You can stand firm on the ground. Anything he may speak. So you have to understand the meaning and relate to answer. So that's how you are going to find the answer. That's very clear. So next step.